but again, the whole point of the 661 studies was to prove Secretary Kennedy wrong when he never said, and I don't know the exact statement, but there's never been any vaccines on the childhood schedule that have had a true random control.
I have the quote here if you'd like.
Yeah, go ahead.
Oh, sure. So Secretary Kennedy said, this was the CNN article reported, that, quote, 76 shots that children in this country receive, unquote, meaning routine injected vaccines on the CDC schedule, quote, none of them have been safety tested in pre-licensure studies against the placebo. And in response to that, the CNN article quotes Dr. Scott as saying that that made Dr. Scott's ears perk up, end quote. Scott, an infectious disease specialist at Stanford University, knew that the assertions couldn't be true, and now he says he has the proof, meaning Dr. Scott, quote unquote, knew the assertion couldn't be true before he even looked and did it. So whatever he's planning to publish, obviously he had his a priori belief beforehand.
So in that CDC study, the way they get 1.1 million lives saved is basically off of 3 diseases: diphtheria, hepatitis B, and measles. And Mr. Siri does an excellent job of laying out some basic numbers that are hard to refute. So let's go through them. Diphtheria, about 750,000 of that 1.1 million. By the way, those 3 diseases account for about 84% of the 1.1 million lives saved according to the CDC. So how do they calculate that? Well, they say that diphtheria, they've saved about 750,000 lives over 30 years. That's 25,000 lives a year is what they're claiming is saved with vaccines preventing diphtheria deaths. The problem with that number is in 1948, when the first vaccine was licensed for diphtheria, the actual death was 634 per year. But let's, by the way, put up the diphtheria chart here. I think we have it on the video as well, don't we?
This is the first.
So the first diphtheria vaccine was put in use in 1929, was it?
It was 1926.
1926.
Senator.
But the first licensed vaccine was 1948.
Well, between 1900 and 1926, the mortality from diphtheria.
Oh, I'm getting to that.
So the first licensed or the licensed vaccine was in 1926, but it was rarely used. And between 1926 and the 40s, the mortality declined at the same rate in areas that used it, mostly major cities.
So by the time the first vaccine was widely used,
1949 was the first licensure.
The death rate had already declined by 97.8%.
When routine vaccine use really began in 1949.
By 26, it already declined by about 80-some%. Well, it wasn't from vaccine. That's from improved sanitation. We weren't living in squalor. There's better nutrition. There's a host of reasons why diphtheria dramatically was reduced in terms of rates per 100,000. So by the time we really started widely using diphtheria vaccine in 1948, we'd already reduced the cases, the rate fatality of
mortality declined by over 97%, and none
by
of that,
98%.
virtually none of that had to do with vaccine.
But
it couldn't
again,
have been.
That year, there were 634 deaths.
That's right.
And the CDC is saying we're saving 25,000 deaths a year of diphtheria.
Yeah.
Okay? So that's the most stark example of this. Hepatitis B, they're claiming 3,000 lives saved per year.
Right.
But in 1980, when that
first vaccine, 1981,
first came about, there were about 294 deaths. It's actually increased now that we've got the vaccine out there.
It's about 1,700 deaths a year now, so the number of deaths have gone up, but they're claiming 3,000 lives saved somehow.
So for measles, they're claiming about 2,700 deaths per year. 1963, prior years to the release of that vaccine, there are about 400 deaths per year. So in total, if you add up those 3 illnesses, okay, a total of 30,700 lives claimed saved per year for those 3 illnesses, whereas the death rate of the year of basically use of vaccines total 1,328. So they're literally claiming a 23-fold increase of lives saved over the actual death count when the vaccines came about. So again, there's all these claims, 154 million, 1.1 million. The numbers simply don't add up. And what's very clear, we could actually put up the measles chart. You can quick do that in the it's the same basic dynamic. By the time we actually had a measles vaccine, there was a 98% reduction in the rate of mortality with measles.
Right. With increasing population.
Again, that's right, the book, Dissolving Illusions. Improved sanitation, improved nutrition, I mean, antibiotics, I mean, other treatment, which is a big problem with me with COVID, that we sabotaged treatment. We ignored treatment and put everything toward the COVID injection. But anyway, I think that's a point that needs to be made. You know, what actually brought down the rate of death in these infectious diseases? Sure, vaccines might have provided the tail end of that, right? But the bulk of the reduction of those diseases occurred well before vaccines ever became popularized. Correct, Mr. Siri?
Absolutely. And overstating the benefits of a medical product is just as dangerous as overstating its risks.
I believe that we are in the midst of one of the greatest crimes in human history. We have a product being injected into children 70 plus times over the course of their development that's never been tested against a proper saline placebo. Over that course of that time period, chronic illness in this country has gone from 10% of children having one or more chronic conditions to now more than 50% of children having one or more chronic conditions. Secretary Kennedy, in the hearing that was last week, said that the latest data from the CDC says that 76% of Americans now have one or more chronic conditions. And I believe that lots of these chronic conditions stem from iatrogenic injury. We have 3 million children with autism. Back in 1970, the rate was so low that it was essentially zero. I'm outraged by that, and I think every person in this room should be outraged by that. I don't know how to say it anymore clearly that we need to change course in this country. And I'm terribly disappointed by the medical profession. In the social sciences, there's this term called epistemic capture, which is when the entire knowledge production process becomes captured by one industry, and that's what's happened with science and medicine. And so I think we need to change course, and I think the people who have covered up the autism epidemic and the epidemics of iatrogenic injury should be held to account for their actions. Let's put it in the context of COVID. I've already talked about autism. Let's talk about COVID. The state, however you define that, the military, CDC, Tony Fauci, Ralph Barrick at the University of North Carolina, created a weaponized virus, correct? Gain-of-function research. They contracted it out to China, and it caused a pandemic around the world once it was released. The government created a weaponized virus that then got out and caused a global pandemic. When are we going to have accountability for that? I generally don't understand why government officials are allowed to engage in gain-of-function
I'm not putting
research.
words in your mouth. I'm just quoting your words.
I would like to
And
have
I think
accountability for the COVID era, and I'd like to have accountability for the fact that the CDC has known since 1999 that vaccines cause autism, and they've covered it up for 26 years. How do we begin to have accountability? You want to call it something different? Truth commissions, criminal trials?
So
I would welcome
you're
that.
comparing the COVID-19 vaccine to the Holocaust.
Sir,
Well,
respectfully.
This is a history of autism. This is a chart showing from, again, hard to say, but with CDC numbers starting in around 2000, from 1 in 150 to now 1 in 31. According to your testimony, back in 1970, it might have been 1 in 10,000, a little less certain than using CDC numbers, but there's been an explosion. What are we doing about it? Who's asleep at the wheel? Who's trying to determine what caused this? As Dr. Chris Palmer said, when it comes to chronic illness, and I'd throw autism in there, they don't want the root causes discovered. That's why people are outraged. That's why people may put on Twitter things that they may regret later. Let's put up the next chart, number 3. This is probably my most censored chart. Dr. Scott, were you aware that worldwide on VAERS we've reported 38,742 deaths worldwide associated with the COVID vaccine? Were you aware of that carnage?
I'm not aware of that figure in particular, no.
In America, I believe the number 19,000, correct? Again,
But VAERS does not prove causality.
oh, I've heard that time and time again. So let's take a look at the bottom figure down here. Of those 38,000 deaths, 9,252, 23.9%, call it 24%, occurred on the day of vaccination or within 1 or 2 days. Now, I know that doesn't prove causation, but man, that's a correlation that we ought to look at. Do you know to what extent VAERS is reported to understate adverse events? Do you have any idea? Have you ever seen any studies on that?
I'm sorry, what's the question?
To what extent does VAERS underreport adverse events? Again, it's a pain to report something to VAERS. Okay, doctors are busy, takes half hour, 45 minutes. A lot of people don't know about it, so the vast majority of adverse events from a vaccine or a drug doesn't get reported to VAERS. So again, they've actually done studies on this. Do you know what percent actually get reported versus what doesn't get reported?
No.
Somewhere between 1 to 10%, correct, Mr. Siri?
No, it's less than 1% according to an AHRQ-funded study of Harvard researchers.
So if it's less than 1%, let's just use U.S. figures. Okay, by the way, what is this? 17,000 or 19,000 U.S. deaths? Yeah, it's close. Okay, it's one of those 17 or 19,000 deaths reported in the U.S. based on VAERS. If we're only recording 1 out of 100, that would mean deaths from the vaccine is somewhere between like 170,000 in the U.S. 170 again. That's at that kind of reporting ratio. This is why people are outraged, and what people are denying. They're not denying the potential effectiveness of vaccines. I think most of us think, yeah, they probably work to a certain extent. Okay? What they're denying are the vaccine injuries, the injection injuries. Mr. Scott, how much do you know about the mRNA technology?
A fair amount.
So is the mRNA that's encapsulated in the lipid nanoparticle, is that true mRNA?
Is that true mRNA?
I mean, true mRNA, your messenger RNA, degrades very rapidly in the body.
Mm-hmm.
Correct?
Correct.
So the mRNA in the injection, is it true mRNA? Does it degrade rapidly in the body? Do you not know?
I do know. Yes, it does. But
it does. It does not. It's modified. It's modified mRNA, and it's designed not to degrade. And there are studies that show it sticks around the body. We don't know how long. The lipid nanoparticle. Do you realize that it was designed to permeate difficult to permeate barriers, like the blood-brain, like the placenta barrier? Did you know that? Did you believe when Fauci told us that the mRNA shot would stay in the arm? Did you believe that? It's a simple yes or no. I mean, do you believe the COVID injection stayed in everybody's arm? Do you believe that's what happened?
Primarily.
You think so, huh? Were you aware of the Japanese FOIA of the study that was conducted of biodistribution where in rats it biodistributed all over the body, accumulated in the adrenal glands, in the ovaries? Because the lipid nanoparticle is designed to permeate difficult to permeate barriers, they knew, the designers knew, and they did a study that would biodistribute all over the body, but our CDC, Anthony Fauci, said it was going to stick in the arm. Now, do you know what the mRNA does? It's not a traditional vaccine, is it? Do you realize that? It's not an attenuated or a dead virus. It's messenger RNA, modified RNA, that's encapsulated in a lipid nanoparticle. It distributes all over the body, and when it attaches to a cell, it unloads its mRNA into the cell, and it turns the cell into a manufacturing cell of a protein that is toxic to it. Do you realize that? Are you aware of that? I mean, just yes or no. I mean, do you know that or not? Because I talk to a lot of doctors who don't have a clue.
I know a fair amount about the mRNA vaccines. Do I know about all of these studies that you're referring to?
This isn't
No,
a study. This is the basic operation. Do you know how it works? It doesn't appear like you do.
Well,
so again, why would we have why would we have almost 1.7 million adverse events, dramatically understating it? Why would we have that number of deaths? It's because these little lipid nanoparticles are distributed all over the body. They're attaching to cells. They're turning cells like a heart cell into a manufacturing site for the spike protein, which is toxic, and the body attacks it. It causes inflammation. That's what myocarditis is. And the designers of the injection knew it. And Anthony Fauci knew it, and he lied. That's why somebody like Mr. Rogers, Dr. Rogers, gets so upset and is outraged by the cover-up of this. That's the problem here. I've got a lot more to say. Do you know anything about, for example, the DNA contamination that's being reported? I want to enter into the record the McKernan study, just recently released, without objection. There's no way to object. Again, have you heard about this? That there's DNA contamination in, particularly the Pfizer? You're aware of that?
yes. And
Do you know at what levels it exceeds the FDA recommended amounts?
No.
36 to 627 times. The allowed amount is 10 nanograms per dose. And this research paper shows it's 36 to 627 times higher than that. Does that concern you?
Yeah, if that's a legitimate finding, yes, that's not the information that I've been aware of.
Yeah, but you know, it saves 3.2 million lives. No, it didn't. It's impossible. That's entirely possible. Okay, so I got the McKernan study there. How about Dennis Rancourt's study? Are you aware of that one? It's a model.
No.
But it's a model of, I think, 17 equatorial and south hemisphere countries whose excess all-cause mortality was highly correlated to the uptake in the vaccine. So based off that study, their data, he estimates 17 million people died of the COVID injection. 17 million. I don't know, it's a model. It's like the 154 million. It's like the 3.2 million. It's like the 2.5 million. It's all those numbers that are confidently spewed. This study gets no reaction. I've entered that in the record.